Conversations for Health, dedicated to engaging discussions with industry experts, exploring evidence-based cutting-edge research and practical tips. Our mission is to empower you with knowledge, debunk myths, and provide you with clinical insights. This podcast is provided as an educational resource for healthcare practitioners only. This podcast represents the views and opinions of the host and their guests and does not represent the views or opinions of Designs for Health, Inc. This podcast does not constitute medical advice. The statements contained in this podcast have not been evaluated by the Food and Drug Administration. Any products mentioned are not intended to diagnose, treat, cure, or prevent any disease. Now, let's embark on a journey towards optimal well-being, one conversation at a time. Here's your host, Evelyn Lambrecht.
Welcome to Conversations for Health. I'm Evelyn Lambrecht, and today I'm joined by Dane Johnson, board-certified nutritionist and the founder of Crohn's Colitis Lifestyle, a company dedicated to helping people with IBD achieve deep healing through a blend of holistic nutrition, targeted supplementation, and personalized guidance. Welcome to the show, Dane.
Thank you so much for having me. I'm so excited to be talking about how we can battle inflammatory bowel disease, Crohn's colitis, microscopic colitis, proctitis, and all the layers of it, and how we could use some DFH to help these clients get massive results, or patients, however you want to say it.
I love that. Yeah, we haven't had a conversation on the podcast about Crohn's and colitis, so I'm very excited to dive deep and also hear your story. Maybe also talk a little bit about your business, because you do have a big online business helping people all over the world with Crohn's and colitis. So I want to ask you about that. But before we dive into your story, what's lighting you up this week?
Well, I just got my house remediated from mold. I found some statue bow trees above my office ceiling here, and that's lighting me up that it's gone, and I'm in my office feeling a lot better. And it was very hard to find. I had to do some in-wall air cavity sampling to find it. I went through 3 companies to actually found it, and we found a lot of it.
Oh my gosh.
That's lighting me up. You know, we bought the house, and the house is now mold-free after lots of money, and lots of time, and lots of learning. So,
yeah, that's quite a journey. We've definitely had some conversations on the podcast about mold, and it's just a crazy journey. Yeah.
Yeah.
So let's dive into your journey. You have a very personal experience with IBD. So I'd love to hear, what happened, and then how did it lead to you now leading this company, helping people with Crohn's and colitis?
Yeah, so pain to purpose is really big. I had a life-threatening case. I was diagnosed with both ulcerative colitis and Crohn's disease by 2 different doctors at 2 different times. And a diagnosis can be subjective. Usually they're going to diagnose through blood, through colonoscopy or endoscopy, and maybe some sampling. And it just wasn't, they were unsure. I had either gastritis or Crohn's. I definitely had left-sided ulcerative colitis, and the predominant amount of my colon was inflamed. And I got sick when I was about 19 years old. So I was a young kid, and I was more fully diagnosed around 22, 23 years old. And then by the time I was on my 27th birthday, I was in a hospital for 5 weeks straight. I lost the ability to walk. I was on 200 milligrams of infused prednisone. I was on TPN feeding tube. I'd already failed 1 biologic, and I was on 3 different antibiotics trying to figure out why I was getting so sick. And I was on 3 grams of Dilaudid, which is 7 times stronger than morphine. So I was really going through it, and it just kind of happened. And this was after I was already studying natural medicine and trying all these famous diets and taking different supplements and going to Dr. Google and seeing what they could tell me. And it was a lot of pain to purpose. And it took me a long time to get my life back. And through that is really what gave me the conviction to dedicate my life to understanding how to battle IBD and different root issues that were never discussed. And I was housebound for a year, and I was bedridden for 3 months. And about a year after that, about 5 years in, I was able to get myself off of methotrexate. I was get off Entyvio. I got off prednisone. I haven't taken prednisone or any of these medications since 2015. So 10 years. And I was told I had to get a full colectomy. I never got a colectomy. I've never had any surgeries. And I was able to stabilize my lab work, normal CRP, sed rate, calprotectin, sigmoidoscopy, and regain 60 pounds of weight and be able to use my digestive tract again. Again, when you have inflammatory bowel disease, it feels like you're allergic to every food there is, and there's nothing you feel, you can do about it. It's just worse. You're anemic, you're underweight, you're deficient in electrolytes, you're dehydrated, and it's this vicious cycle. And for me, I was one of the worst cases. So I had been on the specific carbohydrate diet. I had been carnivore. I had been on the fruitarian diet, eating, 25 bananas a day. And I wasn't getting the results I needed. And that was on top of the biologic plus the immunomodulator. So I would be taking either 6-MP or methotrexate along with the biologic, along with the steroid, cortisol steroid, prednisone. And through all that, it really taught me, because I wasn't able to get out so easily like other people with IBD had gotten. They take a biologic, take a steroid, they watch their food, they go into remission. And that just wasn't me. So because I got so deep, it created this fire in me to not be a sick person, to be okay, and to really dedicate my life to it. And that was about 11 years ago. And so it was very hard. I went from a wheelchair to being able to move and walk. I could go run 5 miles right now and be fine. I can eat a variety of food. I can have a salad again. I can eat polysaccharides or complex carb. I can, do many things because I've restored my digestive tract. I've restored and optimized digestion, drainage pathways, microbiome, gut lining, rebuilt the mucosal membrane, been able to calm down that cytokine reaction, and be able to live life and have certain stressors, whether they be, EMF, or they be food, or their stress of life or mold. And I can keep that calm. And throughout the years, I found a lot of different root issues. So one of the things I want to highlight to any practitioner dealing with someone with IBD is it's not just a root cause, it's root causes, and they're all connected. And the longer someone's sick, the deeper the root issues tend to be. So because over the years of not addressing these root issues, they got worse and worse and worse. And by the time I actually started using and finding root causes, I found massive amounts of Candida albicans right in my GI map, right? Whatever quantitative PCR stool analysis you're doing, found tons of Candida. I found it took a few different tests and a few different methods, but I eventually found Blastocystis hominis parasite and Cyclospora parasite. I also found large amounts of H. pylori. And then obviously with IBD, you're going to be dealing with dysbiosis. You're going to be dealing with some form of SIBO or SIFO. So that was a huge problem. I had gotten C. diff multiple times on and off, E. coli a few times. And I, consistently had to be put on antibiotics. So throughout the year of antibiotic usage, one of my root issues was an unstable microbiome that could not defend and balance itself. So even on a restrictive diet, Candida albicans would easily continue to grow. Bacteria would easily grow. I had lost my keystone bacteria. I had lost that ability, that diversity. And because it was so injured, it was hard for my body to utilize the fibers, the prebiotics, the polyphenols you get naturally from food, because I couldn't properly absorb them and digest them, and they would aggravate the weakened gut. So a good way a doctor can understand this is you can see all the clinical research you want on how good running is for you and how it's good for the heart and your HRV. But if you've got a bum knee, running is not good for you.
Yeah.
And that's much like food for an injured gut with IBD.
Yeah. And I'm curious, going back, because you said that this started around age 19. When you were a child, did you have gut issues? Did you have a lot of antibiotic treatment? Like, have you been able to kind of work out like what, started all this?
Great question. So I didn't get a lot of antibiotics. I went on a few doses for an ear infection or something like that, but nothing much. I think the antibiotic use, once I started getting the GI issues, just exacerbated it, where it went from a little bit of maybe left-sided colitis to this widespread life-threatening condition. I think that was one of the main reasons. But here's something interesting. 1 year before I was finally diagnosed with UC, I was using Invisalign every day. Now, Invisalign's got microplastics. Now, we saw, and if you can look up this, the clinical research has been showing that in some studies of ulcerative colitis, those who have UC had 50% or more microplastics found in their GI tract than the average person. I can't remember who did that study. I think it was Tampa. You check that out. Just go ahead and look up. You'll see it. But we're seeing this massive increase in microplastics and potentially being connected. Now, we see microplastics in our water. We're drinking bottled water out of a plastic bottle. We're wearing Invisalign. We're brushing our teeth with plastic. We're using a microwave with plastic or putting things in plastic bottles. We're constantly exposing ourselves to these microplastics. So I think that was a really big reason. Number two is the processed food industry, right? I was born in the 80s where we saw what? We saw the boom of glyphosate. We saw the boom of antibiotic use. I think it was 1989 that the United States allowed the mass spraying of glyphosate across our crops, which is right when I was starting to grow up. And so you're starting to see more and more glyphosate use, which has been clinically shown to disrupt the microbiome, act as a type of antibiotic, and injure some of those keystone microbiota. And I think what happened over time is my gut lost the ability to balance itself. And so through that standard American diet, I grew up on Papa John's, McDonald's, all that. I think in the increase of the microplastics, I think the increase of the stress, my body lost the ability to control things that started taking over. I think that's when slowly we saw, I think I had candida problems probably when I was 15 or 16. I would get bloat, gas. I was sensitive to sugars. I remember even when I was 14 or 15. But when you're a kid, you don't know a lot. I just remember being like, I'd eat and I'd feel like bloated out to here, like I had a moon under my shirt. And so I think there was some dysbiosis starting out. I like to think that IBS signs are almost like pre-IBD. We've seen a lot of patients come through who were diagnosed with IBS 5 years before, and then all of a sudden they're being diagnosed with IBD because a diagnosis is subjective. If you even think about a colonoscopy, a lot of it is visual. They have this snake-like camera that's looking around 30 feet of bowel, which they can only see about 20, 22 feet of it, by the way. Endoscopy and colonoscopy, they can only see about 22 feet. There's a percentage of the small intestine that cannot be seen in those scopes. But even when they're looking, this is some squished up area that they're visually looking, and they have multiple people looking at the screen to try to, give it a subjective idea of what they think it is. Pancolitis, microscopic colitis, ulcerative colitis, infectious colitis, Crohn's disease, just gastritis. So, that, and then paired with taking the sampling, looking under the microscope for the inflammation at a cellular level. Maybe you also are looking at the anti-Saccharomyces cerevisiae, or other types of bloods to help give you that. But at the end of the day, it's still subjective. And that's why my diagnosis kept moving around. And we've seen many people who were diagnosed IBS, it's not IBD, but no, wait, it is. Or other people starting diverticulitis to proctitis to ulcerative colitis. We've seen that pathway as well. So the disease can progress if these root issues are not dealt with. And so I believe some of those deeper root issues were the bacteria overload, dysbiosis, especially autoimmune driving dysbiotic bacteria, and second is the candida. I think the candida was really big. I think a lot of the sugars, the antibiotics, any amount of that antibiotic use can really make you susceptible to that candida overgrowth. And another phenomenon I've seen is I've seen this correlation with chronic reactivating viruses with the exposure to fungal. Now that's more of a theory there, that I believe that they can be connected between mold or candida, where we commonly see, and this is something I think the doctors listening can investigate, but are you seeing a correlation between someone who has a mold issue and Epstein-Barr virus, or candida overgrowth and cytomegalovirus, or recurring herpes simplex, or Coxsackie or echovirus? And so I like to actually do a test with Dr. Armin on that. He's in Germany. He's an MD in Germany who has his own lab, ARMIN, but he's got these really great tests on viral load, and we think they can be correlated with IBD. But there is great clinical research to show that people with more so ulcerative colitis than Crohn's disease, there's a correlation of finding current active viral load, specifically EBV and CMV, in the patients diagnosed with ulcerative colitis. And so I actually did a lecture on this. I'm lecturing at another functional medicine conference on this, and there's some really good data that I think a lot of our MDs, our DOs, our DCs, and NDs just haven't seen before. But there is clinical evidence showing the relationship between these active viruses and the reaction and inflammation of the colon specifically.
It is really interesting because we have talked about dormant viruses on the show, but in relationship to different conditions, whether it's like Lyme disease or mold or, pandas. And it's so interesting how it just manifests in different people in different ways. I find that absolutely fascinating. So you mentioned the Candida, you mentioned a couple other parasites, like in your personal work. I'm curious, when you're looking at a GI map or another stool test, what are some of the other patterns that you see that are unique to Crohn's and some that are unique to ulcerative colitis? And actually, before I go into that, sorry, I want to back up a little bit, because I have sometimes been confused on like exactly what Crohn's is and what colitis is. And I did look it up, but I just want to go back and like set the stage before we continue. Can you go into that?
Yeah, they're the two of the most famous forms of inflammatory bowel disease, ulcerative colitis pertaining predominantly to the colon, and Crohn's disease pertaining from anything from the mouth all the way down to the anus. So it can be all over. But it's really about the area where they're finding chronic inflammation is best. And it can be subjective and it can change. Now, it's not supposed to change, but we see a lot of people, especially in my community, who have thousands of IBD patients. We're seeing people who have progressive diagnosis and different doctors having different opinions on the diagnosis. So I think it can be subjective and it can progress. As we said, we've seen many people come in with a diagnosis of IBS or undiagnosed. Then a year later, that's happening. And so why? Well, because one theory is these underlying infections, viruses, bacteria, candida, can move through the gut. Actually, the dysbiosis, the fungal growth, can move up the gut. So we can start in a lower area and all of a sudden your full colon starts to get exposed to this. And I think this is one of the dangers of when we don't respond to these issues and we just suppress. So we say, you've got IBD, here's Remicade, food doesn't matter. And I think most of us listening there go, well, that's not necessarily true. If we don't treat these root issues that our microbiome is not able to defend against, like a normal person's microbiome can battle these things. People with, weakened microbiome for whatever that root issue is. Maybe it's the American diet or antibiotics or a lack of breastfeeding. It could be many things, right? That will continue to progress. And then the disease and the diagnosis can progress as well. So once you have Crohn's or colitis, those are usually the most extreme. You can start off with something called microscopic colitis, also known as lymphocytic colitis. Okay. And there are many, and that's more where they're not visually seeing it in the scope, but they're finding it under a microscope.
Gotcha.
Okay. And so, diverticulitis is mistaken as a form of IBD. It's considered outside of IBD. And so things like gastritis as well, but you can have these other issues. And I think another interesting point is you can have infectious colitis that's not necessarily considered IBD. Whereas if someone got food poisoning or something really bad, your colon could swell up, you're getting bleeding, multiple bowel movements a day, the colon looks bad. But once your body clears that infection, it can go back to normal. And so that can be more of a one-off issue where the doctors might say this is just infectious colitis. And so it's hard to tell the difference, because when we look at it from a integrative point of view, it's kind of hard to decipher against ulcerative colitis and infectious colitis. We're finding, E to the 6 Candida albicans in our GI map. So when looking at the GI map, we know that stool tests predominantly look at fecal matter found in the colon, right? That 10 feet, a little bit of the ileum is predominantly what we're seeing in a stool test. It's very hard to see what's going on in the stomach or the duodenum in a stool analysis, right? That bowel movement, the fecal matter is made later on in the GI tract. So what I'm looking for is I'm listening to what their symptoms said, what their doctor said, and looking at what their GI map says. And I'm looking for signs of systemic issues that may not be coming up in the stool analysis. And it could be good to also check it with like an organic acid test at the same time. So you have urine and you have stool, and then maybe get the blood, and you can kind of look and decipher a bit more. But a lot of times with ulcerative colitis, I'm going to see a lot of fecal occult blood. The colon's usually going to be a lot more reactive. I'm going to see, with both of them, calprotectin tends to be higher. So if I'm seeing a 1,500, a 2,500, I know the GI map only goes to 3,000 now as the highest standard value. That commonly is ulcerative colitis. Now, that doesn't mean it can't be Crohn's, but it's more common that the colon is going nuts. Okay, that can happen with Crohn's, but It's more common to see those lower colon issues. Both of them all tend to see low pancreatic enzymes. So the elastase 1 being inhibited, low digestion is a notorious problem for IBD. One of the first things I do with anyone diagnosed with IBD or even suspecting severe IBS undiagnosed, I'm enhancing the digestion. You're going to find that anyone with these issues, low liver function, low pancreatic function, low fire burning for low stomach acid. That's one of my favorite products is to use something that has pancreatic enzymes, ox bile, and a little bit of betaine HCl. I have found personally has worked really well when used properly, right? Right before the meal, start slow, low and slow, titrate up nice and easily. But one of the first things I do is hit that digestion because a lot of people with gut issues don't actually have allergies to the food. They're sensitive because they can't break down the proteins. They can't break down the fibers. Their microbiome is too injured. So if we can enhance that digestion, if we can start enhancing that microbiome, then the food sensitivity might drop and we might be able to handle more variety of food. So no matter what, I'm looking at enhancing that natural digestion and maybe using some natural bitters as well. Maybe even a little bit of apple cider vinegar with some hot water with lemon in the morning can be nice, or using something with natural bitters can be really great, fennel or ginger or things like that. And so enhancing digestion will, if I see that low pancreatic enzymes in the GI map, I'm saying we have to get your liver moving, your drainage working. We've got to enhance your digestion. That's an upstream problem we need to deal with now. And the same thing with the steatocrit, the fat malabsorption is just a common sign. Your liver's stuck. You have a stagnant liver, poor bile production, and without good bile production, your drainage pathways are going to have an issue. You might even be constipated or get a lot of cramping because that bile is needed to move toxins and food through the small intestine. And you're not going to be able to break down your fat solubles. So your 80 KE, you're not going to be properly absorbing cholesterol issues, hormone issues. It's a cascade effect. So almost always, I'm looking at that. I'm saying, what's that steatocrit telling me? What's that elastase 1 telling me? That's probably going to be connected to your EAP and calprotectin. Because if I'm seeing those high and I'm seeing those digestive signs high, it's going, well, look, the inability to properly break down food could also be aggravating the inflammatory response.
Right. And then what about in the bacteria, like keystone species, but also some of the pathogenic bacteria? What do you see commonly?
I commonly see dysbiosis. It's right there. Don't think understand you're not trying to eradicate, you're trying to balance. The problem with people with IBD and IBS, again, is they cannot balance their own microbiome. How is it a person can go out and have a beer and a pizza and do all this terrible stuff and they'll have a bowel movement and they're fine? Their microbiome is strong enough. It can be genetic, what they got from their mother. It could be the fact that they grew up with healthy food and all of a sudden their microbiome was strong enough based on what their parents did that they can go out and just do whatever and be okay for now. So I'm commonly seeing just an overgrowth. And an overgrowth, I think, is a bigger problem than we suspect for certain people. We're all going to respond different to the overgrowth. But that overgrowth is going to continuously release endotoxins, more likely to cause metabolic endotoxemia, where the liver is getting overwhelmed, and that's going to affect bioproduction, digestion, all of it. It's a cascade problem. As long as that dysbiosis is up there, you're going to get those LPS release. You're going to get that endotoxin release. That's going to go where? It's going to be absorbed right into the blood vessels of the GI tract. All blood vessels, all roads lead where? To the liver. The liver is going to be detoxing it. It's going to be detoxing and dumping that right back into the duodenum. So it's this vicious cycle of toxins not being able for your body to get rid of, especially with a poor microbiome, IBD. Because when you've been diagnosed with IBD, I'm almost willing to bet you've had toxin overload, pathogen overload that has gotten worse and worse over the years. It's not something new. By the time you're diagnosed, this has progressed. So that's going to be something I'm looking for. I'm looking for that beta-glucuronidase to give me an idea of how overloaded the body is with toxins. I'm looking for just high levels of dysbiosis. And if I'm not seeing it there, I'm still considering what's going on in the upper GI tract. I'm listening to the symptoms. I'm listening to what this patient is saying about their experience or how they feel using things that could move toxins. Like if I give them a castor oil pack, if I use a little bit of N-acetylcysteine, if I'm using a little milk thistle, and they're reporting brain fog, bloating, diarrhea, anxiety, skin reactions, more excess pimples, then I know that moving their liver is causing a lot of problems and they're having trouble dumping those toxins. the main place the body's dumping toxins is through bowel movements. So you've got to get the bowels moving. You've got to make sure that, I love binders to help with that too. And you've got to get that liver just slow and low on the liver and work that out. What you do for the liver is also going to help the kidneys, it's going to help the gallbladder. And sweat. If you can't sweat, I hear, especially from a lot of women, I tend to hear this where they say they never sweat or they can't sweat. And I say, if you can't sweat, you can't properly detox.
Right.
And so we've got to get that. That's going to be so big for mycotoxins and heavy metals, which our natural divine detox system that was given to us cannot handle. That's where supplements and design for health can really come into play. Is we need help with heavy metals. We need help with VOCs and PFAs and PCBs. We need help with this detoxification of mycotoxins. These are all, very difficult for the body to handle.
Yeah. Dane, you started sounding like a Designs for Health commercial there. We will get into that. So I'm curious about just the treatment, like how you sequence treatment with your patients. But I also want to go back to your story, because you said that you tried all of these different extreme diets. And I know that you went to a lot of different doctors and specialists and also integrative practitioners, right? Not just both. Conventional practitioners.
Yes.
And you still had issues with it. So I'm curious, like, what was it for you that you feel like finally sort of like unlocked the secret? Like, were you not doing digestive enzymes when you tried all these diets?
Great question. It was a different time, 12, 13 years ago, even where we were as a community with integrative practice. It just wasn't as far. It was just harder to get as much communication, understand. I think that was something. Two is I was a kid who was hardly willing, and I was dragged. I was dragged to places that I didn't want to be, and I was looking for them to hack my health.
Interesting.
So the biggest problem was I wasn't accountable for my health. I wasn't the CEO of my health. I wasn't studying this stuff. If a naturopath doctor said, take these 15 caps a day, I might choke them down looking at my clock, waiting for it to kick in and asking, why haven't I healed yet? I didn't understand what I was doing. I wasn't accountable. So I was the main reason, honestly. I had brilliant MDs. I had brilliant NDs I was working with. But also on top of that, I was a very severe case. There was a lot that just wasn't seen or done yet. And, even in 2000, I don't even think the GI map was around in 2012 or 13. I don't think it was, right? It's like 2015. I know the Cyto DX panel came out in, I think, 2018. I think the GI map was like 15, 16, I think is when I even did my first GI map. So, there were other tests, Genova and a few others, but that was probably a big issue. And the second thing is the lack of specialization in IBD. A lot of it's looking at the science, like the science of using biofilm busters is good. The science of doing a parasite cleanse is good. The science of restrictive eating is good. But because of where my mind was, and then these things were put on me without me agreeing or understanding, and then they weren't done in the right way. I think that was a part of your question. Meaning if I was to go on, I think the first antipathogenic I was recommended was something called Miracle Mineral Solution, which is like basically a form of bleach. Like it's like this chloride you use that kills everything off. And now I stunk. I smelled like an onion when I was the sickest. I was terrible. You don't want to be around me. And I had acne all over. I had such severe brain fog, so much. You could tell like I had a white tongue and bad breath and just fatigued. And it was terrible. It was obvious I had so much candida overgrowth, but I couldn't just go and deal with it. My liver was overwhelmed. My microbiome was overwhelmed. I was one step out of a hospital. So it was also the strategy of how do we attack this? Where do we start upstream? What's the chess match of how to deal with this? And I think that's where a lot was missing, and how I like to approach that based on, I was one of the most severe cases that we even see. Some people have been more severe than me, but I was life-threatening. I was sick for many years before I got results, and I was housebound for a year. I had to relearn how to walk, not neurologically, but through such muscle atrophy. I had to gain 62 pounds of weight. I went from 185, 190 to 122. And then I was bedridden for 3 months, and I was housebound for a year. So it was like, this is what I did. When I was in my house, I was just studying and practicing natural medicine. I was patient zero for a year. That's all I did. I was reading 4 to 5 hours a day. I was speaking with my naturopath professors. I was going to lunch with different friends, all in this world. I was studying, trying, doing. And even then, over the last 10, 12 years, I mean, I'm better now at natural medicine, understanding what's happening than I was 5 years ago and so forth, right? So there's a progression on it. But where I like to start is just what pieces do I feel a person can move to restore their gut? The number one thing we've got to win for these patients is we've got to empower them to realize they have to get their mind right. So the biggest culprit I told you was I was depressed, I was anxious. It was everyone's responsibility to heal me except me. And some of these doctors listening right now are going, I have a client like that. They come in, they need me to do everything, and they have no accountability. So I'm looking to start getting them empowered and accountable. Are they willing to go do grounding and do 15 minutes of breath work? Maybe I love a little product called Sensate that helps to regulate the nervous system, and it's connected with sound healing. So you just sit down. If you have a monkey mind, sit down. It's SENSAT. It's this little device, and it helps to engage, regulate your autonomic nervous system, which can also help stimulate the vagal nerve, which regulates digestion, right? So it engages that parasympathetic, and just plays 20 minutes of healing sounds. Go get in the grass, use a Sensate, read a book. The patient has to start resetting and feeling the energy of healing, the energy of peace, the energy of safety, laughter, love, connection. They have to start feeling like they can be of value to the world. These chronically sick and chronically depressed also just feel like a tax on everything and everyone. So they isolate and they hinder, and it's a vicious cycle spiritually just as much as physically. So if we can get them to get empowered with their mind and then make their plan simple, that was big. But where I like to start from a clinical point of view is I like to start with drainage and digestion. Drainage, digestion, and what they're not going to do before what they are going to do. Those are three keys that really help get great results, meaning it's really hard to figure out, okay, I have to take this, I have to take that, I have to be on this, I have to be on that. But what about I'm just going to get rid of alcohol for 2 weeks or a month? What about I'm only going to eat what I cook for 1 month? Now, if someone tells you and walks into your office and says, I want to heal, say, you want to heal? Okay. Before we argue whether you should have this much fiber, that many carbohydrates, this much protein, you should be carnivore or not, I want you just to prove, let's see if you can just eat what you cook for 2 weeks straight. That's hard. It's hard, but it's more about what you're not doing. Because you can cook 3 or 4 meals at once. You can make an elemental shake. Like I love to use the hydrolyzed beef protein. A little bit of that with a little bit of amino acids, a little bit of collagen, maybe a banana and blueberry, maybe a little acacia fiber, with water. I don't need coconut. How's coconut milk going to help me heal? It's not helping. Get it out of the way, right? If it's not helping, it's only hurting. If you got someone who's chronically sick, teach them this. If it's not helping and it could possibly hurt, don't do it. Okay. If it's not helping, it's not hurting. You have to mentally and spiritually get there and just do it for a short period of time and see if you can get a 30% lift in energy or symptom relief or skin reactions or mental clarity or sleep. Just say, give me this for 2 weeks and do it right. Because if I take their plan and I only make it 30% more restrictive and they come back in 2 weeks and there's no progress, now they're burning out. Now they're losing faith. If I'm going to go restrictive and they're very sick, I want them to get super tight for 14 days. Because if I can get a result, now I can start expanding, and it's going to feel a lot better to expand and then to detract, right? So I want to focus on what are we not going to do and make it super simple. Just do it for 14 days. All right. I want something that's going to help reset the nervous system. We know every single person who's ever been sick is saying that stress is connected and implicated with their sickness. Every single one of us. Okay. What's the opposite of stress? Laughter. Peace, breath, presence, sunshine, right? Being of help, being of service. These are the opposite. Just every day they have to practice something of opposite of that stress. And that will we know that the nervous system is connecting what we feel, what we experience to a physical reaction. Meaning if I think something bad happened, I'm going to have a physical reaction to that. I'm going to cry. My heart's going to go up. I'm going to get an adrenaline reaction. My GI tract might go a little nuts, right? There is a nervous system response. We have to have the nervous system teach that patient's body that they're healthy, that they're safe, that they're okay. And this is those energies. Where there is one energy, there is its opposite. So what am I not going to do? How am I going to make it simple? I want to focus on digestion. I want to focus on eliminating things. And I want to focus on nervous system regulation. If they do that for 14 days and they do it right, I'd be willing to bet they get massive results. Most people.
Yeah. And then where do you go from there? I'm curious, like, probiotics, for example, like depending on what's going on, they can exacerbate things for some people, but they can also be hugely beneficial for others. And when it comes to Crohn's and colitis, what are you using? What are you recommending? Do you go higher? Do you switch it up? Tell us a little bit more about that.
So probiotics can cause a histamine or a Herxheimer reaction pretty easily. And so I'm a big fan of starting very low and slow and even trying one strain at a time. I love fermented foods, but I'm not starting with fermented foods.
Yeah.
Okay. So for me, I like to start with the Bifido-infantis independently or the Bifidobacterium because the Bifido is less likely to have that severe reaction. The lactobacillus strains are the ones that are more aggressive, especially for small intestine issues like SIBO or any other issues you're dealing with. So I want to start with light dose, single strain, preferably powder form, and titrate up nice and slow. You can start on the infantis, or you can start on just the Bifidobacterium. And then I'm going to start adding in, the next one I love is the Bulgaricus, and then into the Acidophilus last. If those are working well, I'm usually going to just titrate heavy also on butyrate. Butyrate is so protective of the colon. Butyrate is so good for the pH balance in the colon. It's good for reducing chance of infections, cleaning off cells, helping colonocytes, strengthening the mucosal membrane of the gut. So I'm going to slow and low on butyrate, some Bifido, and I'm going to work because a lot of helping the microbiome is getting out of its way. I mean, in the beginning, you can really just help the, body's nature. Like we all have this essence of the divine. We don't heal people. The body heals itself. We make space for the body to do what it can do, right? Like a wound on your arm. You're not doing that. Your body's doing that, but you're using certain things to enforce that, right? So we're helping the body do what it can do. So how do we help the microbiome do what it can do? Well, you have to get rid of the inflammatory response. If they keep eating pro-inflammatory seed oils, processed dairy they can't handle, gluten, meat high in antibiotics and other pro-inflammatory things, where there's inflammation, you will find a dysregulated microbiome, right? As Dr. Tom O'Brien says, the inflammation equation, if you have inflammation, you're going to have LPSs, you're going to have endotoxins, and you're not going to have a thriving microbiome, diverse thriving. Get rid of the inflammation. So this is where intermittent fasting and meditation can come in play. This is where getting rid of snacking. Like one of the best things you can do in the beginning is try just to have them eat when they eat and not eat at all so they can get the bowel rest when they're not eating. Take it nice and easy with the probiotics because if you just get rid of the inflammatory responses, the microbiome might start adjusting itself. That's how some people do so great on the SED diet. Or the low FODMAP is when they don't do anything else and they just follow one of these famous diets. You'll hear people online say, it worked great for me. Because once they got rid of the inflammatory responses, that allowed the body to reset itself. The diet didn't do it. The diet created space for the body to have a healing response. See, that's why diet won't heal you. Diet just creates space for a healing response. Metaphorically, it's like sleep for the flu. You go to bed to help battle the flu, but sleep doesn't directly cure the flu. Sleep empowers your body to fight the flu. So it creates space for a healing response. That is what nutrition strategies are doing for the microbiome. You're getting rid of these sugars. You're getting rid of eating too often. You're getting rid of seed oils. You're getting rid of fibers and certain fats and certain inflammatory proteins your body is not ready to handle yet. Okay, think of it like physical therapy. If you've got a bum knee, don't go for a run. Do some band work, ice it, elevate it, do some physical therapy for 2 or 3 months. Then maybe you start doing some light movement. Treat the gut like you treat any other body part, like physical therapy, okay? Like organs can be done much like a bad knee or a bad arm or a bad elbow. It has to go through stages. So in that exact metaphor, if I have a bad knee and I do jump rope on day 2 of my physical therapy, that's going to make it worse. And I'm not going to get better. I'm going to get worse. But if I did physical therapy as step 10, after doing 1 through 9 over 2 or 3 months, the same disease, the same problem, the same injury to the knee will now have a therapeutic healing response when done at the right time. So I do jump rope on day 65 and I followed my steps. Now it's helpful. Now it's healing. Now it's helping in the recovery. Same problem, same person, done in the beginning, and it's terrible for them. It's the same with the gut. You got to be careful with the fibers. You got to be careful with the polyphenols. You got to be careful with the probiotics. It's like physical therapy. slowly move it up. In the beginning, get rid of things. Find consistency getting rid of things and add things in tactfully that you think are low risk and high reward. Microdosing low amount of probiotics is low risk, high reward. Mucosal healers. I like slippery elm, marshmallow root, some of these other herbs you can find. I know Designs Wealth has many things that you can go research for yourself and see if they'll work for you. But these things can calm that inflammation, help calm down the gut lining. So that is low risk, high reward, right? Getting rid of snacking, low risk, high reward. Meditation, sleeping at the same time every night. Enhancing digestion when you eat, using some digestive enzymes that can actually help in that process. Low risk, high reward. So start with your defense, start with low risk, high reward. Just give it 2 or 3 weeks. If you're starting to see 20% symptom relief, 40% symptom relief, 50, just keep marinating it. Let that juice, squeeze that juice. The healthier they get, the better you're going to do if you do decide to use some oregano or berberine or, black walnut to kill some of these candida infections or bacteria infections. But if the body can start fixing itself with this person, let that juice squeeze for a little bit.
So I'm curious with the clients who come to you, I'm sure some of them are on the steroids and the immunosuppressants and biologics.
Yeah.
So how do you handle that?
Well, I let them know, first and foremost, I'm not acting as their doctor and they need to talk to their doctor, and I help them achieve the goals that they want, but they have to understand what legally is allowed. If someone is dedicated to get off biologics and they've had the discussion with their doctor, we will discuss what's going on with what are immunosuppressants doing and how can we help reduce the risk that if they choose to come off these immunosuppressants, what that looks like. But what's easier is to talk about the immunomodulators. So like the 6-MP, the methotrexate, the Imurin, or the steroids, which they have to come off of. So that's the budesonide, the prednisone, cortisone steroid. And so a lot of times what I'm always doing with any steroid is I'm working the adrenals. It's the biggest missing link I see over and over again. If you do not support the adrenals and that person titrates off those steroids, they're most likely going to flare up again and have to go back on another steroid dose. So, talk to their doctor. I see these doctors going 30, 20, 10, 0 in a matter of 3 weeks with someone with severe IBD. That's a mistake. You want to be taking it easy. Once someone gets down to about 20 milligrams, ask them to talk to their doctor about, does it make sense by going down by 2.5 milligrams a week or 5 milligrams a week instead of 10 based on their prior experience, especially if this is their third time doing this. Chronic prednisone use is very dangerous. Bone density issues, hormonal issues, gut issues, microbiome issues. So if we're going to get off, I want to increase the chance that this is the last time. They don't need to use it again in the future. So we like the slingshot method. Get healthy with that steroid, then come off and try to be done with it. So adrenals, things rhodiola, ashwagandha, some of these things are really great. Adrenal glandulars can be really great. You guys can search on some of these as well. So I love I'm always using adrenal support, and I'm keeping the dosages higher, especially when they're getting to that level, because I find a lot of people with IBD tend to react again when they get under 20 milligrams. They might do great at 40, but once they get to 20, 15, a little blood comes back, a little pain, a little cramping, a little urgency. So if I see that, I may talk to their doctor about, hey, can we hold this dose for an extra 7 days while we work on adrenals, while we work on the microbiome, while we work on mucosal healers, while we get more specific, and then come down a little slower. And so maybe it's 15, 12.5, 10. Now for me, I had to go 12.5, 10, 7.5, 5, stuck at 5. I was on prednisone on and off for 4 years. So It was 5, 4, 3, 3, 3, 2, 3, 2, 2, 1, 0. So it was real. My body was addicted to it. I could not make my own cortisone. I could not regulate the stress in my body. So every time I got stressed, my adrenals would just get zapped. This is also important when you're detoxing someone where they're having Herxheimer reactions. Adrenal support, super important to help regulate that inflammatory response. So that's probably the biggest one with the steroids, and just taking your time and understanding what you're trying to get off and how long they've been on it and doing that background. Immunomodulators, sometimes we're just on immunomodulators and we're not on biologics, but a lot of times I see them paired together. So I'll see like a severe case who has Remicade and 6-MP. And if everything is legit and we're good and everyone's decided that we're going to now come off these medications, usually we're trying to come off the immunomodulator first because that's easier and the immunosuppressant is stronger and more likely helping to keep that cytokine reactions under control. If I'm going to come off any immunomodulator, or if someone's telling me they're going to come off any immunomodulator or immunosuppressant, I like for them to get the CytoDX test. So either I ask their doctor to cover it under insurance or we're going to do it. I'm looking at IL-6, IL-17, TNF-alpha, IL-1 beta. I'm looking for pro-inflammatory cytokine reactions. If someone tells me they want to get off Remicade and I'm still seeing very high levels of these pro-inflammatory cytokine reactions, I'm then saying that they're not there yet. I want to see normal, non-invasive lab work before deciding to come off, especially if they're symptom-free. So if I'm seeing calprotectin at 500, I'm seeing CRP still elevated, I know the liver's still having a problem, I'm seeing the TNF-alpha still elevated, and they're telling me they're symptom-free and they want to come off Remicade, I am advising against it. And not until that lab work gets normal. So
that's really interesting because if they're on those drugs, technically they should lower all of those things, right? So what is going on then?
Something's not working.
Dysregulated inflammation
or
response.
You're getting a 50% reduction in TNF-alpha. I mean, you could have on the standard reference ranges, I think anything over 17 on CytoDX is considered high, but I treat anything over 8 high on that test personally. Anything 5 or more, really. I mean, I don't want to see a lot of TNF-alpha because if I'm seeing even some TNF-alpha and someone's on Remicade and they're going to come off, I'm willing to bet that's going to go way up within 12 weeks off the biologic when the infusions finally clear out of their blood. They're going to clear quicker with children. They're going to take a little bit more time with the older you are. But around 12 weeks since the last infusion is where I'm looking at their trough levels to see what exactly is going on. And I've done this with, I've had, parents come to me with 3-year-olds, 6-year-old, 8-year-old, 10-year-olds who are, on these long-term chronic biologics, immunosuppressants. So it's a level. So if someone's now coming off, I'm checking cytokines at week 12 from their last infusion. I'm also running, especially if this is someone who had a severe case, I'm running their calprotectin either weekly or biweekly. I'm looking for signs because the labs are going to get worse a lot of times before the symptoms come back. So from week 12 to 16, I'm running calprotectin often, preferably once a week. Then if things are continuing to get good around 16, 18, 20 weeks, I'm going to chill out. Cytokine panel, I want to check once a month if I can. If the budget's there, if their doctor running insurance is okay with it, especially with their background. And if I can, when they're doing the blood, I like to get a CBC and CMP with the CRP and sed rate because they have to draw the blood anyways for the cytokine panel. So if I can get blood with the cytokine, that'd be great. And then I want to be checking the calprotectin. And when the biologics when these people decide to come off the biologics, I'm always asking, what are you substituting this medication with? What are you going to substitute? Don't just come off. What are you substituting? Maybe you can talk to your doctor about low-dose naltrexone. Maybe that clinical research will move you towards that. That's a capsule at night, 1.5 to 4.5 milligrams. I've seen some people use up to 6 milligrams successfully. Maybe natural herbs, endographis, right? N-acetylglucosamine, C3 curcumin. Those are all great to help inhibit certain cytokine reactions. So there is good clinical research that Dr. Brady and his team have done to look at how these things can help calm down IL-6 and IL-1. And there's some good evidence around these natural herbs and fungal that can help. So curcumin is going to be great for that. Yeah, endographis, maybe some mushrooms can also be really good. Shiitake, maitake mushroom, things like that can really help. So check those out. Look for products that have these natural mushrooms or have endographis in it. If you search an endographis, you'll see some with in Designs for Health, and you can do your own research and see if that's best for you and your patients. But I'm looking for those. And I'm also looking to use a higher level. At this point, I should be able to handle high dose probiotics. I want high dose short chain fatty acids, high dose probiotics. A diversified microbiome helps to regulate cytokine reactions. Okay. So you need ample amounts of bifido, lacto, all these strains. Akkermansia needs to be normal, not too high, not too low. You have too much, it's going to eat your entire mucosal membrane. That thinned out mucosal membrane is going to increase chances of your T cells or dendritic cells firing off all these cytokines. So you need to get that nice and healthy. Short chain fatty acids, phosphatidylcholine can be really great for that. Good natural fibers and prebiotics, polyphenols, really great. So I want to make sure that they've been able to work up and diversify their microbiome and handle foods high in polyphenols, handle some prebiotics, maybe a little acacia fiber with a good, clean, extra virgin olive oil. Gundry's got one, Brian Johnson's got one. A bunch of people have them now, right? Real good, clean ones, raw with high polyphenol. And I'm looking to increase the diversity. Maybe now I'm adding in fermented food. Maybe I'm making my own homemade yogurt with lactobulgaricus. Maybe, L-reuteri I think looks really good. I've seen some clinical research, and some people say that it can inhibit the growth of bifidobacterium. I think that's TBD. But I think the L-reuteri, from what I've seen with the IBD community we've worked with, which is a few thousand people, that it has seemed to help with SIBO, one done properly, and they have to be in a healthy place because you can have a terrible histamine reaction, terrible herx on these fermented foods. And how do you do with certain milks? But I find when you ferment it properly with a good, clean milk, cow or goat, it can be more tolerable as the gut gets stronger. So think of that as physical therapy, like level 10, level 15 in that metaphor we were talking about.
Yeah.
So the more diverse I get the microbiome, the more I find it can regulate the candida, the viral, rebuild the gut lining, and control that immune system response. So I'm going to really be pushing for higher dose beneficial bacteria and things that help to diversify and strengthen that microbiome.
That's great. Dane, I think you just answered like my next 3 questions about things you use. So that's great. I have one more question before we dive into the business aspect really quick. Mm-hmm. Since you've worked with so many people all over the world and you have coaches under you, right? Who work with people.
We have doctors and coaches. Yeah.
Yeah. So about how long do you find like the average person works with you to really get to a better place?
Great.
Almost like where they graduate and they feel so much better.
It depends on the person. We have some people who want to stick with us for 2 or 3 years. So I only see about 3 or 4 people now. I used to see about 40 a week. And, all of them have been with me for 2 years at least, because it just depends on the person. Do they want someone there continuing to make them better? Are we now acting out of the fear of Crohn's colitis? Or are we working towards longevity? Because we know from what we see, like what, Dr. Mark Hyman's doing and all these other longevity practitioners are talking about. You can go endlessly with helping with mitochondria and telomeres.
Yes.
And make your heart's 25 years old and you're 65, right? All this new stuff coming out. So you can continue to move with this. Usually we find that we can get someone a minimum of 60% symptom relief 9 out of 10 times within the first 90 to 120 days.
That's amazing.
20% of our members from the calculations we run with our team, and we have NDs, DCs, RNs, we have coaches in Europe, Dubai, United States, all over. We meet and talk about this, and we find that we can usually get great results in 90 to 120 days. There's going to be some severe cases. If you got one of those, you have to have a sit down and say, look, this is layers and layers. Build that trust, build that integrity. I've had people I've worked with where it took a year to get somewhere because they were it was unbelievable how they could not. I knew they had parasites, couldn't get rid of them. I knew they had biofilms, couldn't get rid of them. Liver would not open up, herx on everything, right? That kind of thing. So usually I can get great results, but I'm not willing to speed up the results if I risk things going down or risk this person having to go to the hospital. So I'm going to go low and slow. I'm going to play that defense we talked. And I think a big thing I want you to take away today, guys, is you can get amazing results just playing defense. That's what a restrictive diet is. What's the risk of restricting your diet? Well, maybe if you're anemic and you're not getting enough calories, right? But it's minimal if you know what you're doing. So play the defense. And a lot of times defensive things like beneficial bacteria done right can be more defensive. It's the parasite cleanse. It's the coffee enemas, and it's the biofilm disruption where the danger is. That's where you have to be careful with all that. So we always say the 80-20 rule. We can usually get 80% of the symptoms gone within 90 days. And then the 20% can take months. Like you're running a GI map. You have to run another GI map in 3 or 4 months. You need to do mold testing. You need to detox on mold and get in the sauna for 3 or 4 weeks straight. You need to do a liver cleanse or a gallbladder cleanse. I mean, things can really take time depending on what your goal is. So I think sitting down and talking to the patient and saying, this is what our goal is in the first 90 to 120 days. I never do one-off sessions. I only do long-term contracts. Our minimum contract is 3 months. Okay. The average probably more about 4. And I would say about 30% of our members work with us for 4 to 8 months. And then they can decide. And then we have a percentage that will work with us for a year, 2 years, 3 years. But it's like delivering on the promise. How long will it take you to deliver on the promise? I find it takes, if you really specialize, that's why I only see IBD, because I find like a lot of NDs who are seeing thyroid, then they're seeing Crohn's, and then they're seeing MS, and then they're seeing depression or obesity and diabetes. It's so hard to be great. So when someone walks in my office with IBD, I've probably seen their case, and my practitioners have seen that case 500 times.
Right.
That gives me a massive edge to really quantify how well do I think I can help this person. So I'm really a big believer. That's why I've always stayed there. I haven't just talked about gut health. I really focus on IBD, but we do see undiagnosed IBS.
Yeah. And that's actually great leading into the business aspect. You've really specialized. That's part of it. Yeah. What is something else that you feel like has really, really helped your business and lead to so much growth?
So story is big. I think something that is really important, I think it's going to become even more and more important, is people need a place to go that people can relate with them. They need relatability. I think that if practitioners can be more vulnerable about their own experiences, it's not about you, it's them. But if you help treat what was so hard for you, you're going to have an edge over anyone with any DR or anything. And people need that relatability, and they need that extreme niche and focus to walk in their shoes. So I think story is huge. I think passion and like what you do for yourself, help others do what you've done. Number two is nowadays you've got to be just as good of an entrepreneur as you are a practitioner. And that's a scary truth. And I think one thing that gave me an edge is I had a background, and I just grew up around computers. I grew up around the internet. I knew it. And I was able to create certain things. Like I don't have huge upfront costs around brick and mortar. I'm able to build systems around the world with lower costs. And I can find, we can find our patients or clients anywhere, Dubai, Africa, India. We had probably 4 people join our program today. And it's because we're building systems. So ask yourself, do you want to build, you just want to do do you want to build a company, or do you want to build a solution where you are a great practitioner and you know who you serve? I think you can make great money while serving people in a balanced, integral way, both ways. I went from, okay, I'm a practitioner, I've maxed out how many people I can see. I've gotten massive results with IBD. Now, do I want to invest in building a company, or do I want to stay here? And staying here is completely fine. It's actually, you're not going to go as insane. So I think that, spend your story, take some time to start learning about email marketing, get your Instagram moving. Even if you're not getting shares and likes, it's about having consistency and integrity on what you're saying and what you're doing. Start asking about how to get on other people's podcasts. I think, for me, I really focused on Instagram. I focused on email marketing. I focused on storytelling. And the more I told my story, the more people wanted to hear my story. That's partially why I'm here today. And I got around other people with the same goals. So other practitioners and other digital entrepreneurs. And again, guys, this is 11 years later. This is not some quick thing. The first year I revenued $8,000 revenue total. So be patient with yourself and learn. And you have to, the first thing also I'd say is you have to learn how to do sales, not scamming, not scheming. You have to be able to look and understand what makes someone need something. So I would say stop selling hourly rate. Stop telling someone an hourly rate. No, sell a package. It was one of the best things. Right now, if you're selling, I want you to work just on this. Sell a 3 to 4 month package. Because at the end of the day, if someone spends $3,000, $4,000, or $5,000 and they were able to get the result, and you're confident that in that time you can get them the result, they're gonna recommend you to everybody. People want to invest in what will work. You have to be relatable. You have to be integral. You have to be authentic. You have to feel very confident in what you're going to do and how you're going to get them the result. And you have to be really good with their money. So there are times where I'll say, let's not invest $1,000 in all this labs right now, because I already know you've got bacterial overgrowth and liver's a problem and you're eating a bunch of crap. Let's just put our time and energy and money into things where the rubber meets the road, not the North Star, which can be labs sometimes. And like what I'll do is I'll make sure they get the best products at the best price I can get them. I'm not as incentivized to make all this money on supplements. I want results. I want a testimony. That's the most valuable thing I can get. I want this person to say this is the best decision they've ever made. Protect your brand. Your brand is what people say behind your back when you're not there. If you make an extra $2,000 on somebody, but they don't get the results, your brand is suffering. Okay. So deliver on the promise. Even if I've gone above and beyond for so many people where I said this and I did more because I want to be integral. And my renewal rate of patients staying with me at a high ticket was 80%.
Wow.
80%. Why? Because I was niched. I had what they had. I specialized what they had. I could show them 100 testimonies. And then I really put a plan together of like what success is. So the last thing I'm going to say about business is if you are not starting every session with them with a success tracker, you're losing because you don't know them. Take 10 minutes at the beginning of writing down what is success for them. Is it bowel movements? Is it energy? Is it anxiety? Is it that? You need to be able to track what's happening and they need to tell you what they need. Even if they're not getting perfect results, if they feel understood and they feel like you have perfect clarity on what they need and why, they're going to already feel better about you. If you just get in there and hand them 5 products they don't understand, they're going to eventually just feel like this is not working out and it's a money thing. So use a success tracker. Okay. There's a great patient portal called Practice Better. And we just built one on a template and it's like goal 1. And we like to rate things 1 through 10. Like I said, what are their goals? So it says like, I'm looking at goals around the colon. So colon symptoms are going to be like mucus, urgency, diarrhea, blood. Upper GI tends to be bloating, gas, cramping, constipation, pain can even be. Another bowel movements during the day, bowel movements at night. What's your energy like? What medications are you on? What's the dose of the medication? Where are you with your mind? So take 10 minutes on that. I'm going to reframe. I'm going to simplify and say back to them, okay, so this is where you are. This is how you're feeling. This is what we need to do. Not you, we, because I'm on your team, because I'm with you. Okay, we need to get this. We need to attack this. We need to figure out why this isn't working. The second biggest thing is stop recommending supplements to your patients that they don't understand. I have a piece of homework. I call it solving supplements. And what they have to do is they have to write 2 to 3 sentences on each supplement they're taking and what it does for them. And if they can't, I tell them not to take it. Okay. This is going to do a few things. How many clients do you have where they overdose on something and they freak out Herxane? You're going, I told you 1 cap, not 4. What are you doing? They go way too quick. They have to understand what they're hiring you for, and what's worth more than the symptom relief is to be trained on how to take care of themselves. So train them, teach them like be their leader. Don't be a reactive customer service agent. Be a proactive leader and teach them about what they're doing. If they're taking NAC, what is it? Give me 2 sentences on NAC. Give me 2 sentences on milk thistle. Give me 2 sentences on this digestive enzyme. And so just create a little piece of homework and just write it out. And another thing we do is we categorize our supplements. 5 categories that might help you out. So we call them. This is just something we made up. Okay. Mucosal healers, supportive supplements, anti-pathogen supplements, probiotics, and binders. So if they can walk into any grocery store, I will pick up a supplement and say, what category is this? What category is this? So now it gets easy in their head. Okay. To be great at something, to teach something is to make it simple. Okay. And success is always simple. LeBron James, right? Greatness makes it look simple. Your patients are overwhelmed. So simplify it for them, lead them. Don't just react to what they're saying. Make sure you're accountable for their success tracker as much as they are. Too many doctors' offices I walked in and they have no journaling, no breakdown of what's been going on with me. So now it's on me. What am I paying you for? I need you to keep track of what's happening, because when they tell me the bowel movements were 6 to 8, and now they're 10 to 12, I already know within 5 minutes, something's freaking out their colon. I need to look at their plan. What can I calm down the colon? Maybe I need more binders. I need to watch what they ate. I need more mucosal healers. Maybe they had a bad reaction to a suppository or something like that. So when I do success tracker, within 5 to 10 minutes, I'm already knowing what I want to talk about without having to hear the anxiety from the patient and the 20-minute story of like, we got an hour. All right. I need to get through where you are in 10 minutes. So they get heard and I know what's going on just on that success tracker.
Dane, thank you. That was such a thorough answer. I asked you for like one thing on business and you gave us like a 10-minute spiel. I love it.
Yes. Sorry. Let me breathe for a second.
That was great.
Yes.
You actually answered a lot of things that I was going to ask as follow-up questions. So that's great. Okay. Since we've run out of time, I just want to ask you our rapid fire questions to finish. Okay. So what are your 3 favorite supplements just for yourself right now?
Liposomal phosphatidylcholine, I love that. The research on it's amazing. Just type in PC for the gut lining. I'm going to say something like butyrate, because I've had lower amounts of short chain fatty acids, and I take a lot of fermented foods now, so a probiotic supplement isn't as needed when I've dialed that in.
Mm-hmm.
But I mean, short chain fatty acids so good for the colon. I'm going to say that butyrate, PC, and I'm going to say I really like the vitamin D 10K Avail with the new higher dose of K. I think we are so underdosing K1 and K2 with vitamin D, with the whole worry of hypercalcification. I really love the new formulation designs Health did on that vitamin D 10K. 1 cap, 10,000 IUs plus 1,000 micrograms of K1 and K2. And if you're really worried about bone issues or hypercalcification, that BRF 45 is also really good with that really high dose K2. And you can't overdose on D or K. So research it, check it out. But I'd say that I love keeping my D. My D's up there personally.
Nice.
Yeah.
And what are your favorite health practices that you practice most days?
Hyperbaric oxygen therapy. I have an HBOT at my house, so that's big for me.
Oh, wow.
And I really like doing any kind of nervous system regulation. I think it's the more you do supplements and biohacking and you don't feel safe in your body and you still have this anxiety or stress in your life, that nervous system regulation is just key for long-term success.
Yeah. So
I like that little device Sensate. I think that's cool. I'll even do that in an HBOT. So I love stacking. That's really good. And next, I would say sauna. 170 degrees or higher. The clinical research is amazing. What it does for your HRV, what it does for dopamine, your ability to release mycotoxins, especially with the mold I found in my office. Yes, get rid of that black mold. Get those binders up. Get that sauna up. All the clinical research is 180 degrees or higher, but it's harder to get that in your house.
And then final questions for you. What is something that you've changed your mind about through all of your years in this field?
That Crohn's colitis is incurable.
All right. I like that.
I'm not going to go into that one. I'm just going to leave it there.
Okay. Well, thank you so much, Dane. This has been very enlightening. Thank you so much for sharing all of the clinical pearls that you shared, but also all the business pearls. Really love that. So thank you so much for joining us today.
Thank you, guys. Happy healing.
Thank you for tuning in to Conversations for Health. Check out the show notes for resources from this episode. Please share this podcast with your colleagues. Follow, rate, leave us a 5-star review wherever you listen or watch. And thank you for designing a well world with us.
This is Conversations for Health with Evelyn Lambrecht, dedicated to engaging discussions with industry experts, exploring evidence-based, cutting-edge research, and practical tips.